We will talk about frequent urination causes. We will discuss 5 most common causes of frequent urination. First, let's define what means frequent urination. When person urinates more than usual, it is considered frequent urination. Or to be more specific, in normal cases, person urinates around 6 to 8 times per day, or in per 24 hours, 6 to 8 times. So if person urinates more than 8 times per 24 hours, it is considered frequent urination. Most common cause of frequent urination is urinary tract infection. Urinary tract infection usually caused by bacteria, and bacteria affects urinary tract such as bladder and urethra, sometimes ureter and kidneys also. Usually infection affects bladder and urethra. Urinary tract infection is responsible on 30% of cases of frequent urination. So in most cases of frequent urination, person will have urinary tract infection. There is highest probability that if person says that he or she has frequent urination, it more commonly means urinary tract infection. Other symptoms of urinary tract infection is painful urination, frequent urination, and urgent need to urinate. So urgency is also another symptom, and painful urination. These 3 symptoms are most common: urgency, painful urination, and frequent urination. It indicates urinary tract infection. Classical method of diagnosis is to check bacteria in the urine. So urine analysis is important to define bacteria in the urine, and diagnosis is made by symptoms and presence of bacteria in the urine. Treatment, standard treatment and first line treatment is Nitrofurantoin, 6 to 7 days, and it's usually enough for treat. Trimethoprim-Sulfamethoxazole also is used if there is some limitations, but there is resistance in many cases of these antibiotics. That's why it is avoided in many times. And if other antibiotics are not effective, Fosfomycin is used. Fosfomycin, usually single dose is enough. So Nitrofurantoin, first line treatment. If it's not available, Trimethoprim-Sulfamethoxazole are used, and if other treatments are not effective, Fosfomycin is enough and is effective treatment. Second most common cause of frequent urination is overactive bladder. Overactive bladder affects around 15% of population, general population, and it affects much more people among after 60 or after 70. So the risk of overactive bladder increases with age dramatically. For example, after 70, the rate of overactive bladder is increased several times. So it's directly correlated with age, but also it occurs in younger ages sometimes. What is symptoms of overactive bladder? Frequent urination is common symptom, more than 8 times per day. Also, a person many times wakes up during night time. It is called nocturia, and person wakes up to urinate. Urgency is also important symptom, and involuntary bladder contractions. And it's important to rule out other causes, rule out infection. We should rule out infection to diagnose overactive bladder. So overactive bladder symptoms in many cases are same as infection, urinary tract infection. So we should rule out infection first to diagnose overactive bladder. Another common cause and third most common cause of frequent urination is diabetes mellitus. Diabetes mellitus type 1 and type 2 also. Both of them causes frequent urination. And what are the other symptoms of diabetes? It's increased thirst, increased hunger, increased urination. Polydipsia, polyuria, polyphagia is classical triad of diabetes. So this triad means diabetes mellitus. It can occur at any age because it's frequent urination is symptom of diabetes type 1 and type 2 also, but type 1 diabetes is rare. So more classical form is among older people after 40 usually, and people who is obese or overweight usually also is important. Fourth most common cause of frequent urination is pregnancy. During first trimester and third trimester, especially when there is rapid growth of uterine, there is mechanical compression on bladder, and we have frequent urination. It's common for pregnancy also. And medications, diuretics cause, especially in people who has hypertension, and diuretics are prescribed to manage hypertension, and at this case there is common of side effect as a frequent urination. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.